Hi, my name is Michele. I'm originally from Rockville, Maryland. I did my undergraduate at the University of North Carolina in Chapel Hill, and then I did medical school at Nova Southeastern University in South Florida. I'm currently a PGY2 resident, and my hope is to pursue a pediatric emergency medicine fellowship after I finish here at St. Chris. The reason I chose St. Chris was mostly for the people. Everyone I met here was wonderful. We really are like a big family, even though that sounds cheesy, but I love all my co-residents. All of the attendings are always willing to help and teach, and everyone here has been so supportive throughout the whole process. The other reason I chose St. Chris is because it's been a great combination of a community hospital where we're really involved in advocacy and in the North Philly community, but we have the support of Drexel and Tower Health behind us, so we get all of the resources that come with being university associated as well.
Okay. My name is Jasmine, and I'm originally from Roanoke, Virginia, and I went to the University of Virginia for my undergrad education. I later went to Drexel for my medical school education and ended up coming to St. Chris for residency. I'm currently a second year, and I'm interested in critical care medicine, whether that be PICU as well as NICU, we'll see. One thing that really attracted me to this program was the educational aspect. I felt that St. Chris had a great environment for education, as once you come into the hospital, you're learning from the moment that you step in, whether you're learning about your patients that you just admitted, or you're going to chief rounds, new conference, or grand rounds. I felt that all day I had an opportunity to learn, and I also appreciate our teaching from our attendings and our fellows that we have as well. One other thing that attracted me to our program is the diverse patient population here. I was a chapter president of the Student National Medical Association, or SNMA, at Drexel, and one thing that I really like about our program is working with the more group. We basically help with minority recruitment as well as minority initiatives around our hospital. Working with Dr. Guevara has been a really great part of that group. And so these are some things that brought me here.
Hi there, my name is Nikita Gupta, and I am a second-year PEDS resident in the St. Chris residency program. I'm originally from upstate New York, new to the Philadelphia area, and I went to medical school in Albany, at Albany Medical College in Albany, New York. So far, I've been loving my experience in Philly, and I can't wait to tell you about the things that I love here about St. Chris. When I interviewed here at St. Chris, I knew that there was something special about this place. Specifically, I could see how close the residents were to one another and how comfortable they felt being here. In addition, I knew that I was looking for an all-children's hospital where the sickest kids would come here and end up staying here for the whole amount of time. That way we could see the trajectory of their care. Finally, I knew I wanted to be in a place where I could work with the underserved population, and there's no better place to do that than Northeast Philly. Here at St. Chris, we even have a separate advocacy block in order to look at resources that are available to our patients in the community, and this is such a great place to be able to learn how to use those resources and really be advocates for our patients. When I came here to St. Chris, I realized that a lot of the things that I had found to be true on interview day are very much true in life as well. The thing that I love most about here is definitely my co-residents and how close we are with one another along with our senior residents. It's really easy to be able to have great relationships with people within the program, but also outside of the program. Philly is a great place to be able to explore, whether that's going to new restaurants or happy hours or new art museums, and there's so much to do here. Finally, this is a great place to feel very well supported. Whether that's from your senior residents who you're constantly learning from every day, attendings and the rest of the support faculty, even to the lunch ladies who really know my order by heart by now. In terms of things that I'm involved in, one of the committees is called Graduate Medical Education Committee. We work as a liaison between the residents and the higher ups, meaning the residency program leadership, in order to voice concerns that our residency brings up. This can include concerns such as the night float schedule or different call schedules in general, and these concerns are always being voiced in order to make our program better for us. I feel like this is a great place where you can really have your voice heard, and that is one of the things that I definitely wanted in a program, because I wanted to know that while I was going to be training hard, I would also be well supported. Overall, we can't wait to see you here, and good luck with interview season.
My name is Luke Hartman, and I am currently a second year at St. Christopher's Hospital for Children. I went to medical school at Ben Gurion University of the Negev in Beersheba, Israel. I have not yet decided what my future career plans are, but I'm currently thinking maybe primary care or urgent care. When I was first interviewing for residency, I made sure to ask everyone that I interviewed with what their favorite part of their program was. And when I asked that question here at St. Chris, the answer I got was the education. And that really stood out to me because that was the only time I had received that answer on the whole interview trail. And now, having been here for almost a year and a half, I have to agree that my favorite thing about this program is also the education. As residents at St. Chris, we are given so much autonomy to take ownership, learn from our patients, and make decisions. Additionally, as a children's hospital in a very diverse and underserved community, we are able to engage in a large variety of clinical care opportunities. These include our many subspecialty outpatient clinics, our core inpatient rotations where we care for kids with very complex cases to the bread and butter of pediatrics, and also in our general pediatrics outpatient clinics where we learn not only how to care for our patients medically, but also how to take a social determinants of health approach to care. Additionally, the attendings at St. Chris are so warm and so helpful. They're always receptive to questions and concerns, both during the day and at night, and I'm so thankful for them. I'm so thrilled and excited to be here at St. Chris and to be a part of the St. Chris family, and I know you will be too.